All right, YouTube, guess who's back? Right? All right, getting back into the science. Here we go. All right, so, Cliff Notes, and today's content is on critical insights into narcotic analgesics. Okay? Now, what we want to do is help students and career nurses to see through the larger concepts. We want to make sense of this stuff. It shouldn't be as hard as people make it. Anyway, I'm Cliff Davis, registered nurse. All right, you know how we do. Our note takers are ready. Which of the following medications are hydrophilic in nature? Select all that apply. Again, select all that apply. Hydrophilic in nature. We've got A, fentanyl, B, morphine, C, dilaudid, or dilaudid, however you want to say that. All right, tomato, tomato. Here we go. All right, what do you think? Jot something down. Type it in. Here we go, answer. Both B and C, morphine and dilaudid, okay? All right, so why? Why is the question, okay? And how is it pertinent? Here's how it's pertinent. Hydrophilic means water-loving. It means that the medication has an affinity for water. It's capable of interacting with the water, right? So what does that mean still? If you have a client who is dehydrated, then those pain medications that are hydrophilic aren't going to be nearly as effective because your client at his baseline does not have enough water in his body to support or bolster the effect of that medication. So it'd be critical to understand that that patient needs to be well hydrated if we're expecting to get the maximum benefit out of morphine, if we're expecting to get the maximum benefit out of dilaudid, okay? And breaking that down a little further, Greek for hydros, okay? We know that that means water. And philia means friendship or loving, so water loving. All right. Now, but this is our Cliff Notes, and you know how we do this, right? We make sure that you understand. Our intent is not for you to just know in the moment. Our intent is for you to know for good, right? All right, now, so focus your concentration on that M in morphine, okay? And here's what we're going to do. We're going to simply take that letter M. Let's make a copy of that letter M. Or, you know what, let's bring it down and share it. Here we go. And while we're in the process of sharing it, let's move this out of the way. Okay, yeah. Because we're going to take this M for morphine, and we're going to remember that if we flip that M upside down, we've got water. That's right. So all you're doing is flipping that M for morphine upside down, and we understand that it's affiliated with water, and its basis is that it is hydrophilic in nature. Absolutely. All right, moving on. All right, so now we want to look at the other piece of the puzzle. Lipophilic comes into play. All right, so now having an affinity for fat. All right, so pertaining to or characterized by lipophilia. So fat loving, essentially, right? All right, now why is that pertinent when we're talking about our patient? Remember last time when we said they were hydrophilic, what? The dehydrated patient is like, whoa, you know, the medication might not work. Same theory is true here. If our patient is emaciated, right, or cachexic, that's a great word. If our patient is emaciated or due to their chemotherapy treatments, or that they're older or something of that nature, they don't have enough fat on their body for the fat-loving medication to be effective. All right? And what medication are we referring to when we talk about fat? Well, we are talking about, right? F from fat, F, fentanyl. That's right. So we take that F off of fentanyl, and we remember that fentanyl, right, has a tie with fat, right? And if our client does not have enough fat on their body, we realize that fentanyl might not be that effective. By the way, notice that you've got fentanyl patches that you may put on your patient, right? And where might those patches be the most effective, right? An area where there's a little more fat on their body, a little more adipose tissue. Yes, right? So this medication is more effective when you have patients who have a greater degree of adiposity. You like how that's said, right? A greater degree of adiposity. All right, now, that brings us to this thing, dye, all right? Dye, because we're talking about Dilaudid as well. So we've hit on morphine, we've hit on fentanyl. Now it's time to talk about Dilaudid. And what do we understand about di? It's a prefix, meaning twice, two, double, all right? And while we're keeping that in mind, let's take a look at Dilaudid, all right, with emphasis on that DI, double, twice, okay? And with that in mind as well, we understand that Dilaudid then, wait for it, right, is what? Both hydrophilic and lipophilic at the same time. So Dilaudid is literally its name. It has both natures. So when we go back to our original question, which asked which of the medications had hydrophilic natures, right? What do we got? Morphine and Dilaudid partially. Dilaudid is partially hydrophilic and morphine is hydrophilic, whereas fentanyl is what? Fat-loving, which makes it lipophilic. Absolutely. That's how we do it here at RN Cliff Notes. We want you to know. When it's time for the exam, we don't need you to guess. We need you to know. We need you to know the answer in the exam in class. We need you to know the answer when it comes time to take the NCLEX. And know the answer when you become a career nurse and provide effective care and effective pain management. Thank you, ladies and gentlemen. Please subscribe. Please like. Please comment. All right. Until next time.